Hi, I'm Dr. Jeffrey Kyle.
And I'm Dr. Alvaro Raimunde.
And let's talk about all of this haze that's been going on for the past 2 days due to the smoke coming down from the Canadian wildfires.
Yeah, we've been getting a lot of calls today, in particular today, as the air quality reached hazardous levels. A lot of the questions we've been getting are, what should we do? Should we be concerned? Is it safe to be outside? Is it dangerous for my kid?
So over the past 2 days, the air quality has gotten progressively worse and worse, and today is probably the worst day. And I don't know if you can appreciate it from the video, but we're in a lot of haze. It smells like smoke. And these things are all irritants to our lungs and our bronchioles that are in our lungs, and can cause some irritation that really can lead to some problems, such as headaches, cough, fatigue, and a general feeling of poor well-being. And there's certain people that are actually more vulnerable to this than others.
Yeah, so the people that are at most risk for complications or some of these side effects are kids younger than 5, especially infants, and the elderly. Also, kids that have a history of asthma or other respiratory conditions or chronic lung conditions or heart conditions. So all of these pieces, we should all stay inside for the next couple of days until the air quality gets better. But if you're in one of these groups, you should definitely stay indoors with the windows up and shut.
Right, so indoor activity. If you can have an air purifier in your house, that can actually help. And if you can't have an air purifier that's large enough to cover your whole downstairs or whole house, you can have it in a certain room that you use as your clean room. If all of your windows are shut and you're still smelling smoke, you could also take some wet towels and put them around the gaps in your doors or in your windows to sort of help prevent it.
If you do have a history of asthma, talk to your provider to see if it's time to up your controller medications, especially if you have an inhaled steroid medication that you use.
And anything that you have indoors that can actually decrease your air quality is recommended to try to not do as much of. So dusting, vacuuming, running a gas stove actually could increase the poor quality of air that you have in your house. So anything you do to damp that down will actually be helpful.
Absolutely. So in summary, stay indoors until everything kind of clears up, and definitely call your provider if you have any other questions.
Mm-hmm. And how do you check your air quality? If you go to airnow.gov, you can sort of see where your air quality is. It generally should be 50 or less in the green zone that you'll notice. We'll put up a picture about what this looks like. Today we're over 300, which is unfortunately a hazardous level. So be safe and be cautious.